Hello, everyone, and welcome back. Today, I would like to discuss some guidelines to follow to make your resistance training safer and more effective. Resistance training can be highly beneficial for middle aged and older adults, but it is important to follow certain guidelines to ensure safety and effectiveness. Here are key guidelines to keep in mind. Develop goals. Start by identifying what you want to achieve through resistance training, whether it's increasing muscle strength, gaining muscle mass, or enhancing overall functional abilities. Clearly define your goals. Ensure that your goals are attainable and realistic for your age and current fitness level. Setting unrealistic goals can lead to frustration and potential injury. Take into account any health conditions or medical considerations you may have. Consult with your healthcare provider to determine any limitations or modifications needed for your resistance training program. Start with a warm-up. Before beginning any resistance training exercises, it is crucial to warm up your muscles and joints to reduce the risk of injury. This can be done through light aerobic exercises such as walking on a treadmill, exercising on an elliptical cross trainer, or doing windmill toe touches. Dynamic stretches, which involve moving your muscles and joints through their full range of motion in a controlled way, can be performed. Dynamic stretches are different from static stretches, which involve holding a position for a period of time. Examples of dynamic stretches are torso twists, forward leg lunges, arm swings, etc. If you are doing specific parts of the body in your workout, then you need only warm up that area. For example, if you are only working out the upper body, then you need only do warm-up exercises for the upper body. If you are doing a very intensive exercise such as squats or deadlifts, it is a good idea to actually do warm-up sets of that specific exercise in addition to your general warm-up exercises. Start with 50 to 60% of your 1 repetition maximum for the first set. Increase the weight by 10% for each subsequent set. For the final set, use 80 to 90% of your 1 repetition maximum. Focus on good form throughout your warm-up sets. Don't go to failure on any of your warm-up sets. Rest for 30 to 60 seconds between sets. Listen to your body and adjust your warm-up as needed. After this warm-up, rest for a couple of minutes and begin your actual working sets. The order of the exercises? Compound exercises should always be at the beginning of the workout session, followed by the isolation exercises. Taking the bench press, which is a compound exercise, as an example, this exercise recruits the pectoralis major, the pectoralis minor, the triceps, and the anterior delts. If you exercise the triceps or the delts prior to doing the bench press, these smaller muscles will be fatigued by the time that you attempt the bench press. You will not be able to lift as much weight as a consequence and therefore will not develop your chest as well. Use proper form and technique. When performing resistance exercises, it is essential to maintain proper form and technique. This helps to target the intended muscles and reduces the risk of strain or injury. In particular, avoid using momentum to lift the weights. This reduces the effectiveness of the exercise and places unnecessary stress on your joints. Focus on controlled movements and use your targeted muscles to perform the exercise, rather than relying on momentum. Pay attention to breathing. Breathe naturally throughout the exercises, exhaling during the exertion phase and inhaling during the relaxation phase. Exhaling during the exertion phase prevents holding your breath, which can increase blood pressure, cause dizziness and fainting, and strain the cardiovascular system. Inhaling during the relaxation phase allows oxygen to replenish the muscles, promoting better endurance and reducing the risk of dizziness or lightheadedness. Stay hydrated. Proper hydration is essential for middle-aged adults who engage in resistance training, as it helps maintain optimal physical performance and supports overall health. Middle-aged adults should aim to drink an adequate amount of water throughout the day, especially before, during, and after exercise. Here are some guidelines. Before exercise, start your day by drinking a glass of water upon waking up to rehydrate after overnight sleep. Consume approximately 8 ounces or 250 milliliters of water about 30 minutes before your workout. to allow for proper fluid absorption. This helps prevent dehydration from the outset and ensures you're well hydrated for the upcoming exercise. During exercise, during resistance training, aim to drink 150 to 250 milliliters of water every 15 to 20 minutes. This amount may vary depending on individual factors, such as intensity, environmental conditions, and personal sweat rate. Monitor your urine color as an indicator of hydration status. Pale yellow or clear urine suggests adequate hydration, while darker yellow or amber-colored urine indicates the need for more fluids. Avoid sugary drinks during exercise, as they can contribute to dehydration and interfere with performance. Stick to water or sports drinks specifically designed for hydration and electrolyte replenishment. Exercise in a cool environment if possible. To reduce sweat production and fluid loss, wear loose-fitting clothing to prevent overheating. After exercise, immediately following your workout, consume 8 ounces or 250 milliliters of water to replenish fluids lost through sweat. Continue drinking water throughout the day to rehydrate fully and recover from exercise. While the general recommendation is about 15.5 cups, 3.7 liters for men, and 11.5 cups, 2.7 liters for women, it's important to listen to your body and adjust your water intake based on your individual needs. Here are some signs that you might be dehydrated: feeling thirsty, having dark-colored urine, urinating less frequently, feeling tired or sluggish, having dry mouth or skin, having headaches. Emphasize compound exercises over isolation exercises, but use isolation exercises to prevent overtraining or for lagging body parts. Compound exercises should be given priority over isolation exercises because they offer a number of benefits, including being more time efficient, more effective for building muscle and strength, and more functional. Compound exercises work multiple muscle groups, so you can get a more complete workout in less time. Compound exercises allow you to lift heavier weights to stimulate muscle growth. Compound exercises also mimic movements that you perform in everyday life, such as lifting objects, squatting down, and reaching overhead. However, compound exercises often prove to be too demanding for middle-aged adults, particularly when employing free weights. If you feel that you are overtraining because you are doing too many compound exercises, either reduce the number of sets of the compound exercise or switch them out with isolation exercises until you are further developed and can return to compound exercises. Also, if you find that a particular body part is lagging in development, this is an appropriate time to target that body part with an isolation exercise. Do joint-friendly exercises. Choose exercises that are gentle on the joints and minimize the risk of injury. Low-impact exercises using resistance bands can be excellent options for middle-aged or older adults with joint issues or arthritis. Include balance and stability exercises. Integrate exercises that challenge balance and stability to help middle-aged or older adults improve their coordination and reduce the risk of falls. Examples include single-leg stands, heel-to-toe walks, and standing on an unstable surface, such as a balance board or wobble board. Balance and stability exercises can be done at any time during the week. We will be doing a video on balance exercises in the near future. Include core strengthening exercises. Include exercises that target the core muscles, such as the abdominals and lower back, as a strong core helps with stability and proper posture. Most important is the fact that a strong core prevents injuries. Planks, ab crunches, and seated twists are effective core strengthening exercises for middle-aged adults. Balance the exercise of opposing muscle groups. Opposing muscles are referred to as agonist and antagonist muscles. It is important to exercise opposing muscle groups in an equal, balanced manner to avoid injuries. An antagonist muscle is a muscle that opposes the action of another muscle. When one muscle contracts, the antagonist muscle relaxes to allow the movement to occur. For example, when you bend your elbow, the biceps muscle contracts and the triceps muscle relaxes. The triceps muscle is the antagonist to the biceps muscle, which is the agonist muscle in this movement. Agonist and antagonist muscles work together to create smooth and controlled movements. For example, when you walk, your quadriceps muscles contract to extend your knee, and your hamstrings muscles relax to allow the movement to occur. When you bend your knee, your hamstrings muscles contract to flex your knee, and your quadriceps muscles relax to allow the movement to occur. Here are some other examples of agonist and antagonist muscle pairs: biceps and triceps, quadriceps and hamstrings, pectorals and lats, deltoids and rhomboids, abdominals and lower back muscles. It is important to have a balance between agonist and antagonist muscles. When one muscle group is stronger than the other, it can lead to muscle imbalances and injuries. For example, if your quadriceps muscles are stronger than your hamstrings muscles, you are more likely to experience a hamstring injury. Include functional movement exercises. Focus on exercises that mimic everyday movements and activities, such as squatting, bending, pushing, and pulling. These functional movements help middle-aged adults improve their strength and mobility for daily activities and reduce the risk of falls and injuries. Target all major muscle groups. Include exercises that target all major muscle groups, including upper body, chest, back, shoulders, and arms; lower body, hips, thighs, and calves; core, abdominals, and lower back. By incorporating exercises that work these muscle groups, you can improve overall strength, stability, and functional mobility. Lift to near failure. Lifting to failure means continuing a set until you can no longer complete another repetition with proper form. Studies are mixed regarding lifting to failure. There are studies that indicate lifting just prior to failure, 2 reps prior to failure, is just as beneficial as lifting to failure. My recommendation is that you occasionally lift to failure, just to be able to determine at how many reps and at what weight intensity failure will occur. Training a failure can put stress on your joints and muscles, increasing the risk of injury, especially if your form is not perfect. Beginners and persons with prior injuries should definitely not lift to failure. Some exercises are more dangerous to do to failure than others. For example, it's generally not recommended to train to failure on exercises like squats or deadlifts, as these can put a lot of stress on your lower back. If your primary goal is to build muscle mass or strength, you may benefit from training to failure occasionally. However, if your goal is to improve endurance or prevent injuries, you may want to stick with lighter weights and higher reps. Keep an exercise log. By looking back at your exercises over a period of time, you are better able to find errors made and make improvements in the design of your exercise plan. Finish with a cool down. A cool down is a period of light activity that is performed after a workout. Cooling down helps your body to return to its resting state safely and efficiently, and helps to reduce muscle soreness and improve recovery. Examples of cool down activities are walking on a treadmill and static stretches in which you hold a position for 20 to 30 seconds. Seek professional guidance. If you are new to resistance training or have any health concerns, it is always advisable to seek guidance from a qualified fitness professional, a physical therapist, and your healthcare practitioner. If you enjoyed this video, make sure to subscribe for more content like this. Don't forget to hit the like button to show your support and share this video with anyone you think would find it helpful. We love to hear your thoughts and answer any question, so please leave any comments or questions. Thanks for watching, and remember, live long and live healthy.